Good afternoon, everybody, and welcome to my third webinar about IPC and COVID. And my third webinar will cover the management of COVID-19 waste and the management of deceased patients with COVID-19. So our objective of this session is to know the general and standard MSF waste segregation management, describe the COVID-19 waste management, and the third part will be how to manage and deal with a COVID-19 deceased patient, either in healthcare facility or in a community level. As for waste management, we need to have a general idea about our waste management to know the safe segregation, collection, transport, and disposal. And of course, the appropriate personal protective equipment and tools for cleaner and waste management people who deals with waste at waste zone area. First, we need to have an idea about the waste hierarchy, which start by reducing the waste, or what we call as 3R, reduce the waste, or reuse, or recycle. As we see in this triangle, we start from prevention. It's the most favorite option, then minimization, reuse, recycling, energy recovery, and at the end, disposal. As the MSF standard waste segregation, we have 4 types of waste. We have the sharp, which goes into either safety box, as you see in the picture, and this is considered as needle or any blade or any that contain sharp in a healthcare facility, or it's a thick plastic box. We have the vials, the ampules, the broken glasses, which goes to a plastic container. We have the soft waste, and this soft waste is divided for general waste and medical waste. And of course, we have the organic, such as placenta or any amputated organ. Waste segregation is everyone's responsibility as healthcare worker and at patient level. So our part is to educate patient about waste segregation also. This is about solid waste. So we have another type of waste in our healthcare facilities. This is waste water. We have first the spillage, the liquid spillage. For example, when we have any excreta, vomit, blood, urine. So we need to use an absorbent cloth, single use, to absorb all this liquid first. Then we need to clean with water and soap, then rinse it with water. Then at the end, we will use chlorine 0.1%. For the black water or the sewage water, or like, for example, any excreta like urine. So from we pour the liquid from bedpan or bucket in either toilet or sluice room, any place which is dedicated for this sluice fluid. And then this bedpan again will be washed and decontaminated with chlorine 0.1%. For the main storage tank, there is a risk of dislodging needs. So logistic or Watson will take care of this, and they might use 1 part of 10% lime slurry per 10 part of waste. So we need to follow on this with the Watson or logistic department. As general waste management plan, we need to have an idea about sorting of medical waste. As I explained, like we have many types of waste, and we need to segregate accordingly. We need to know how to handle this waste in the way from origin till the waste zone. and of course, the storage and final disposal of the waste. So we will have some sorting tips, like we need to sort always at the point of generation of waste. So whenever we have a generation of waste, we need to segregate and sort this waste immediately. We need to always keep separate container in convenient places. So for that, we have different bucket for different waste. We need to use color-coded bag to distinguish between general waste and medical waste container. Like, for example, we are using the black waste bag for the general waste, and we use the yellow for the medical waste. Of course, we need to place the sharp container in a convenient place at a minimal distance of staff. No need for staff, like, for example, if they are giving injection or they are putting IV for the patient to go for a long distance, handling the needle in their hand to dispose it in sharp box. This will expose them more into incident of needle prick, or expose others for this incident. What about the handling tip? We need to minimize the handling of medical waste as much as possible. We need to ensure that medical waste in sharp containers are discarded when they are 3/4 full or 2/3 full, at least once a day, and maybe more than this. It depends on the necessity. We shouldn't put our hand into any medical waste container, and we shouldn't move medical waste from one container to another or from one bag to another. And we shouldn't dispose or empty our medical waste into open carts. This will increase our vulnerability to injury or to spillage and environmental containers. So always we need to keep our waste either in a closed bag or in a closed container. Of course, we need to have tips on the interim storage and final disposal of our waste. So we should never store our waste in an open container. Always we should look for closed containers to store our waste. And this waste either can be for temporary holding at any IPD level or any medical facility level before the final dispose in the waste holding zone or the main waste holding zone. So waste should be stored in container with lid to minimize the exposure for insect, rodent, or for any animal infestation, and of course to minimize the smell. And this is for sure, like now in summer, this is like with high heat, the smell will be more. For that, we more advised to keep it closed and not to overfill this container with bag in order to leave the top open. This is for general waste. What about the COVID-19 waste? So the personal waste of any suspected or confirmed cases with COVID-19, regardless what it is, water bottle, food left over, all is considered infectious as it get into touch with suspected or the confirmed patient. And as we know, the persistence of the virus in the environment on different surfaces, so we should take care of this and consider all this waste as medical waste. So we need to make sure that all this type of medical or general waste issued in a COVID-19 treatment center are treated as infectious patients. How we will segregate the waste. In MSF project, most of our MSF project having in-house waste management and in-house incinerator or crusher for shards. And in some country, we have outsourced waste management company, which comes and collect the waste and dispose it or manage it according to her protocol. So in-house soft waste will be placed inside a closed container or bags, which should be sealed and brought directly to the waste area. For example, if it is temporary holding, it will be inside the isolation unit. And then from the isolation unit will be taken to the main waste zone, where it will be stored and will be dealt with it accordingly. While for outsourced waste management company, all COVID waste for suspected or confirmed cases is considered infectious. So all this waste will go into yellow medical waste and sent to the waste holding zone for the company to come and collect it. And for example, this is a case of our project in Lebanon. What we need to know for the collection of waste in-house. In our facility where the waste zone is available, so any closed bags or closed waste container, when it is 3/4 full, it should be wiped, or we can hand spray with the small sprayer with 0.1 chlorine. We should make sure that the handle of the bucket is also clean with 0.1%, or the area where we handle the bag is wiped or sprayed with 0.1%, then transfer it. Usually we have this big bucket to transfer into the waste zone where the waste storage are kept. For any outsource, it's the same. We will take it to a waste holding zone where the company will come and take it. For any sharps, the sharp should be placed either in reusable sharp container and or it's a plastic box where we are taking the ampule to the crusher machine in waste zone, or in a cardboard safety box placed inside a bucket to protect this safety box from damage, especially when it's exposed to any fluid. Always the safety box should be transferred for disposal outside the isolation, and we need to ensure, like, when we are taking any safety or sharp box from its place, which is full, we need to inform the nursing team that they need to replace this safety box. For the collection of waste from outsourced company, they will collect the yellow bag, which tied properly. Some of this outsourced company, they are requesting like to place the waste in double bag. So the first bag will go into the second bag, and again this bag will be wiped or sprayed with chlorine 0.1%. Of course, medical waste will be transported to a specific area in a specific closed cart for temporary waste holding. Sharp box also will be secured, closed properly. Again, we need to wipe it with or hand spray it with chlorine 0.1% before transporting. And again, sometimes the company are asking us to place this sharp box or safety box inside a yellow bag. We need to ensure either we have our own waste zone and waste treatment, or if we are sending to outsource company, a proper bag closure. So we need to have either to do a simple knot for the bag, like what we see in the picture, or we will use the goose neck or swan neck method, like turn the bag very well and then make it in a way that we can close it with the self-locking tag. And this self-locking tag, when we lock it, it will lock it, and it cannot be break except if we use any sharp or any scissor to cut it. As I said, we have two types of waste disposal. It depends on the field. We have in-house waste disposal, where we have incinerator for waste and crusher for sharps. And we have the outsource, which is through a certified waste management company who will come and collect the waste in a special truck and transport it to its own facility, where they have an incinerator, autoclave, or a shredder machine. With all that, we need to know, like, when we are dealing with the waste, despite it is in the waste zone or it is while handling the waste from isolation ward into the waste zone, what is the personal protective equipment required for the people? First of all, for the hygiene agent who's handling the waste from isolation room into the main waste disposal area, they need to have, of course, their boot, a coverall, N95, face shield, keep the coverall hood on their head, and of course, protective gloves. While in the waste zone itself, where they will do the incineration or treatment of waste, they need to, the person who's dealing with this type of waste, they have to wear the heavy-duty thick leather gloves, especially when operating the incinerator, as this gloves is resistant to heat, and it's thick, which does not allow any puncture from sharps. And we need to ensure that any protective gloves will not be used. We need to use at that area this heavy duty gloves. If we have any rubbery gloves which heat resistant and thick, wearing they can wear it, but again, this should follow the process of reusable PPE by cleaning, sending to laundry for washing with soap and water, and decontaminating with chlorine. Of course, in addition to this heavy-duty gloves, he needs to wear the coverall, heavy-duty sole boots, face shield, reusable apron, and of course respirator or mask, as we see in this picture, which is special for dealing in that area. And this type of respirator has two filters which need to be changed at least on 6 monthly basis, and maybe more. It depends on the use. As we finish the part of waste management, we need to know how to deal with the dead body, as unfortunate one of the complications of COVID-19 is some of patients are the complications are leading to death. Like recently, the death rate has decreased compared to what it was before. In this presentation, I'm going to talk about the standard death body management to remind the staff dealing with dead body how which type of PPE what they need to follow and all the precaution they need to deal with it. And of course, to consider the context acceptance with the waste, how we deal with waste management in COVID-19, but also one of the complications which we face with COVID-19, and it's unfortunate result to have a deceased patient. As we know, like before, there was a high rate of deceased patient noted in the past few weeks, but we can, I can say like recently the number of deceased patients is getting less. And in order to know how to deal with this deceased patient, we need to know how to deal it at two levels, either at healthcare facility, and this is most of the cases, but sometimes we might face it at community level. As we know, in a hospital, like the doctor will come and check the patient, and he will identify that the patient has passed away and announce his death. While he's in his room, the preparation start for the bodies. The nursing team, the healthcare worker will go open all windows and doors to improve the light and the ventilation. Ideally, we should wait 15 minutes outside before proceeding with any body preparation. Of course, we need to prepare the patient by removing all lines. If he have, for example, IV cannula or any Foley's catheter or any tube, it should be removed preferably in his room before or dedicated ward before transferring to the morgue. We should place the body in either in a body bag, or we can wrap it in any type of cloth, like for example the bed sheet or the sprouts, which cover the whole body for transfer to the morgue. And of course, we need to identify this body bag by placing a tag with maybe with the patient name and the patient medical record number. When we are transferring the body to the morgue, the body bags will be wiped with 0.1% chlorine solution, especially on the handle of the bag. And we need to ensure like there is no leakage from the bag or anything. We can use absorbent pad. There is no special transport equipment or vehicle required, but we need to keep both the movement and the handling of the body to the minimum to avoid turning from side to side. In the morgue, if the body is placed inside the body bag, healthcare worker of the or the mortuary staff should wear appropriate PPE before dealing with the body. They should wear on top of their working clothes or their face shield, respirator mask, protective gloves, cover all and Charlotte and rubber boot. Of course, they need to minimize body manipulation as much as possible. Ensure safe and dignified storage of the body until final ceremony. And in case of use of coffin, body bag should be placed inside. Some of the people, like for example here, if we are as healthcare worker preparing this body for later on stage, some religion or some people, they would like to have somebody participating in the preparation of the body in the morgue. And here we can allow like at least one of the relative to come in and provide him with the appropriate PPE and the appropriate instruction on wearing the PPE and how to deal, and to follow up strictly our information. in dealing with this, and especially like, for example, I will give the example of the Islam situation where some ritual washing is needed. So it can happen with the minimal manipulation of the body, but again, we should provide all the relative person with the proper PPE. Regarding the burial, we need to check the public health requirement. It depends from country to other. We need to confirm with the local authority about the process. As a lot of people will think like this is very difficult and it's infectious disease. So as what I can say, like COVID-19 is not like Ebola, and we can process with a regular burial if the local authorities allowing. And we can allow at some point the family member, one or two, to see the body after being prepared, but they should be instructed not to touch or kiss the body. We should emphasize the standard precaution at all time. For example, hand hygiene, and to keep the safe distance of 2 meters at least when they are dealing. We shouldn't allow relative with elderly relative or with any underlying disease to enter that body. Just to reiterate, like till now there is no evidence of dead body transmitting disease to others, except in the cases where we are performing any autopsy which lead to any aerosol generator procedure. We need to instruct the people who's going to perform the burial, if it's the family or a specific company, that the person who's putting the body in the grave, he should wear gloves, and he should perform hand washing with soap and water immediately after removing these gloves. Also, we need to ensure our environmental cleaning, especially after finishing the body preparation, and ensure that no contamination from the environment will happen. So we need to clean the environmental surfaces by the 3 bucket methods, one for water and soap, and one for water to rinse after water and soap, and finally to decontaminate with chlorine 0.1%. Of course, we need to collect soft waste as medical waste or as infectious waste in closed bag and transfer it to the waste zone. And the all linen generated there, like if we wrap the body with a bed sheet, we need to send it to laundry to follow laundry protocol, and this is in addition to the working clothes of the healthcare worker. In regards to patient belonging, like watches, phone, any personal item, we need to disinfect either with ethanol 70% or with chlorine 0.1% before handling to any family member. As I said, like this was for the healthcare patient admitted, but there is at community level. And again, this is according to local authority. Recently, we are having some people who are very mild cases, and they need to have home isolation. But at some point, if any of these cases have a sudden death, so we need to treat this patient as COVID-19, same as in the hospital. Some of the community or IDP are required or mandated by the health authority if somebody died, despite it is with COVID-19 or a regular death, they need to take the body to a healthcare facility where they will get a death certificate, and then the process will follow the healthcare facility process. But in case some of other community, when they have the death confirmed, so they will perform the preparation at the community level in the place where the person has been living. Of course, this is at some point will follow religious and some requirement from family for religious preparation. So any of the family member or religious leader who's preparing the body should wear the personal protective equipment. And here is the role of our health promotion in educating this type of people on how to deal with any disease with home isolation requirement in a community level, by educating the community about the personal protective equipment, how they will manipulate the diseased body, reduce, use the minimal manipulation of the body, reduce the people who's encountering this body, so limit the number of people in contact, and ensure they will use at least some PPE like protective gloves, or even disposable gloves. If they don't have protective gloves, they will wear a mask. They can cloth mask can be an option, and like they need to minimally manipulate the body or turning the body. And of course, like when they finish their religious preparation, they can allow one or two from the other family member to come inside. But again, we need to reiterate that this family member, they shouldn't come in contact of the body, neither kissing or touching the body. And we need to reduce the exposure of any elderly people or having underlying disease to come near the dead body. Of course, always we need to respect 2-meter safe distancing when we are allowing any family member. We should teach them also about the environmental cleaning, like we need to instruct the personnel who perform the preparation of the body that they should remove and change their clothes immediately and wash it. While the deceased body clothing can be washed either by a washing machine with a warm water at a high temperature, 60 to 90 degrees, of course with laundry detergent, or if they don't have the machine, they can do hand washing of linen, which can be soaked in hot water and soap in a large drum using a stick or steer. And after that, we need to rinse it and place the linen in actually 0.1 chlorine for approximately 30 minutes. Also, in our health promotion or our health education to community, we need to teach the community on how to dilute the chlorine solution. And of course, finally, we rinse it with water and dry it.